Hello, many
Hi.
for being here. We are now with Siegrid Delaney, and it's a testimonial of Hands for Healing online training. And we're gonna start asking you, instead of me introducing you, I'm gonna ask you to introduce yourselves, please, Sigrid.
Yes, of
Tell us who you
course.
are and what you do.
Thanks, Maite. So I am a health practitioner. I'm a doctor of Chinese medicine and acupuncturist. I also practice nutritional and herbal medicine. I've been in practice now for nearly 20 years. And some of that time I've been running my own clinic for the last 12 years. I've had my own clinic in Sydney, and I see patients of all kinds, all ages and genders, and I work with a lot with fertility, a lot with chronic illness, and children as well. And basically people come to see me when they want to feel better, live a better, healthier life, and they need some help turning that around. Sometimes patients come to me on a regular basis because they find it that having acupuncture is part of their life management routine, and so they come regularly, like once every 2 weeks or once every 4 weeks or something. And I've had some patients that have been coming to me for over a decade, and then others come because they've got a particular problem and I help them to resolve it, and then they move on, and then I might not see them for another 6 months or so, and they come back again. I work a lot with food, helping people know what to eat and how to enhance their vitality and how to look to the way that they're feeling to gauge whether they're doing the right thing for their bodies or not. So if they're feeling a bit flat or a bit low, or their mood's not great, or their skin's not great, or their other symptoms are starting to come up, then there's a sign that something needs to change. And so I help them kind of figure that out. And then when we're in treatment sessions, I use the variety of skills that I've got. So acupuncture and lymphatic drainage the core. And then recently I completed hands healing training, and now I use that as part of the treatment on probably most people that come into my treatment room. I do a little bit of that on them, and some more than others. And I now find it to be an invaluable part of the collection of tools that I use in my treatment.
Beautiful. And how is making a difference in the way that you practice?
It gives me a tool that doesn't require needles, so that's great. Some people, they want to do something to transform their health. They've heard from someone who's worked with me that that I've helped them, and they want to come and get me to help them as well, but they're a bit worried about needles. They're not so into acupuncture. And so it gives me something that I can do that doesn't have needles. And also some people, just on some days, they're feeling really sensitive, and they just, it just gives me something that's more gentle, and can really just kind of tap into that side of people that needs sort of more nurturing, and especially for people who are super sensitive with needles. So I really like that aspect of it. And I've used it quite a bit on children. So some of my patients who've had children going through something, and they're like, I now that I know that you can do this, I think I might bring my sort of 12-year-old daughter to you, or my 3-year-old son to you, and we just try and do some hands healing stuff and see if that helps. So yeah, I find that it's really good with children. And it's really good with people who are sensitive, but then also it's really, really, really good for people who have some emotional, psychological, like upheaval going on in their lives, or some stress or trauma that is creating problems for them. And I find that, combining the hands healing work with the other things that I do for those people is really, really helpful.
Do you have any stories that you could share about how Hands for Healing has helped some of your patients?
Yes, I have many. Let me think of a couple. Okay, so last week I saw a woman who I've been treating for a while, and I said to her, and I think I've only done like a little bit of hands healing on her before, and I said to her, I think we really need to focus a bit more on the hands healing, sort of the energy balancing side of things today. I mean, people don't know what hands healing is. And so I find one of the challenges for me has been how to communicate what I want to do and what I think the benefit is, and then just kind of help them understand that it's not hocus pocus. And that it is something that has real and tangible and measurable influence after I've done it. And by measurable, I mean, okay, so their energy might be low, and then I do some hands healing work, and then all of a sudden it's high. So they can measure that by the way that they're feeling, and to say, yes, I was feeling low energy, now I'm feeling high energy. So there's a definite change there. And so that can be with all sorts of symptoms. And then of course it's a little bit hard to know exactly which one is causing, which thing. And as I explain to my patients, it's usually a constellation of things. It's never just one thing that can completely transform your health. It's like a little bit of what you eat. It's a little bit of how much sleep you get. It's, then there's, in terms of the treatment, it's, okay, there might be a bit of acupuncture, then there's the hands for healing, and everything has an influence. And when you tie it all together, then that's when you can have these significant changes that happen. And that most people are after a significant change. They don't want to keep suffering in the same way for a long time. And so usually the idea of having something that I offer them that has the ability to like supercharge their transformational potential is enough to let people go, you know what, I'm willing to try it, even though it might sound a little bit left of what they're used to. And by the time I offer it, usually there's a bit of trust between us as well. And so they're willing to let me offer something that I think is going to help, especially because it's so gentle, relaxing, and there's no downside to it, really. So anyway, with this woman, she had been just feeling flat. She had some emotional things going on with her family, and she just was finding it hard to, wasn't feeling good every morning. She had changed her diet, and we'd been doing some acupuncture. She just was missing that kind of spark in the way that she was feeling. And so I decided that I thought we needed to focus on the hands healing work, and I found that there were some imbalances that I was able to address using the hands healing technique, and sort of energetically changing the pattern that I was feeling, and then connecting it. The great thing about hands healing is that there are techniques that you can learn to anchor the changes into the energetic map of the person, so that you can anchor it in, and that stays in place. So it's not just that they're on the table and you make a change and then they get up and they walk away and it all goes back to the way it was. You actually have these tools that you learn about how to anchor things in place, or really gel it into the framework of the energetic framework of that person, and so that becomes a really lasting change. And so anyway, I applied those techniques, and then and she was feeling okay. And then, I said goodbye, she left. And then she came back to see me the next week, and she was just like, oh my goodness, so mind blown that she just felt so good. And she everything, she said, I don't know what you did to me, but that was just so good. After within a couple of hours of leaving, she said that she just felt she sort of took a breath differently, and her lungs felt different, and she could see more colors, and she was seeing more like just the way that she interacted with the world around her had opened up, and she just felt that in a very, it really affected her senses, but then also it affected her like level of joy. Like, she felt like there was a cap on how happy she could feel, and then all of a sudden that cap got taken away, and she just, she felt like she just had all this happiness and joy that she was able to experience from small things, where nothing major really happened. So that was really really great feedback that I got. Other times I've had one, sorry, I'm going probably a bit long, but there was another one that I had with a woman who had period pain. So more of a very common physical complaint that I see. And with this particular woman, we've been trying herbs, acupuncture for quite some time, and it just didn't really seem to be shifting in the way that I would have expected it to shift with the herbs and acupuncture, the way that I was doing it. And for me, that's a sign that something is a little bit deeper, and that there's something that I can do with hands healing that might enable the shift to happen, so that the herbs and the acupuncture and the diet and whatever other lifestyle changes are happening can actually really start to take effect. And if you're doing all of these things and the symptoms not changing, then there's something else going on. And so so this woman who had period pain, long-standing period pain, I was able to apply some hands healing techniques that I'd learned. And I found some things in her body while I was doing it that needed balancing. And again, I was able to anchor that into the energetic web of her being to make it lasting. And she, the next time I saw her, she said that for the first time in years, she felt that her period pain was about maybe 50 to 70% better. So it wasn't completely gone, but there had been this significant shift. So we're going to keep working. She's coming again. I'll keep working on her. As with all things, it's not usually as simple as flicking a switch and doing one treatment and everything is forever changed. And in some cases it can be. But, I also know from just my clinical work for so many years that, where one layer is addressed, there's another layer underneath that might be from something else, or another layer and you just kind of keep on peeling away the layers and hoping that the symptoms change and the energy improves and the quality of life improves. And so then it's as with any clinical practice, it's about just checking in with the person and seeing what changes there are. And I have found that the changes are really very positive, all positive when it comes to hands healing. So some bigger than others, but definitely positive.
So do you think hands for healing would be helpful for health practitioners?
So helpful. Yeah, I already talk a lot to my colleagues about how helpful it's been for me. I think that it's a great clinical tool to have up your sleeve, whether you use it on everyone or whether you just use it for some people. If they really seem like there's something kind of underlying going on that you're not quite sure what it is, that's a great time to use hands healing techniques. But overall, even if you just use the same techniques that you've been doing, mostly hands for healing training improves your sensitivity. So it improves your ability to feel at a level that's off the body, but also within the body. So when you enhance your sensitivity, then you can start to feel that there's like some extra, tension in certain muscles, or that there's some heat around an organ area, or that there's a whole area of tension that's manifesting in a zone of the body. So for some people, and I'll see them now, I can just immediately tell that there's a whole lot of tension, like across maybe through, for example, just through the middle of their body, like coming across from the liver to the stomach to the pancreas, like that whole ridge is like really tight, and you can learn how to feel that. And so then from that, I might decide to address that only with acupuncture, or I might decide to address that only with dietary advice or herbal medicine. But the sensitivity that I have to perceive those changes is definitely improved and enhanced from doing the hands healing training and learning from the teachers who brought their wealth of experience in assessing people's energy and body changes, and their wealth of experience that they brought into that training has really helped me.
Some people have questions about how this energy healing could be done via Zoom or online modality. So you think you could learn it even if it's online?
Yeah, I wondered that myself too in the beginning. I've been doing training, like professional development training for my whole acupuncture career, and we're always face to face. And when you're feeling something, there's usually a body in front of you, and you get to palpate, and the teacher can come be right there, and they can help you. And so I did have questions in my mind about how we would be able to do this training, this level of energetic training via Zoom. And I was pleasantly surprised at how successful it was. And just, for anyone listening, to let you know that the way that it's done is very clever, really. It's there are certain times when you have to bring a person with you, so that you've got a person in front of you that you can work on, and then the guidance is given from the teachers, and then everyone has an opportunity to describe what they're feeling, and then the teacher via Zoom sort of describes what to look for. And then there's a very, very easy real-time ability to ask questions as you go. So just using the Zoom functions, and saying, oh, yeah, I've got a question. I'm feeling something that seems like this, but I'm not really sure, like, what could that be? And the teachers are like, okay, so this could be this, or in my experience, I worked with a patient once, and this is what I found, and da, da, da. So it's like, it's really peppered richly with their own clinical experience working with patients, which I found very helpful, because I know from working with people that it's, people are so unique. So you just kind of need to be able to put the pieces together yourselves, and remembering the stories that the teachers told sort of will come to me sometimes when I'm working with a patient, and I'll go, oh yeah, that's right. I remember he worked on that patient and found this thing once, and it all just kind of comes back. And so the way that the teachers deliver the training makes that Zoom experience very easy. And then also the teachers taught us how to engage in group healing, and where all the participants in the program were coming from their own homes, and some of them from different countries, and even with that distance, we were taught a technique of how to connect with all of the participants in the group, and to use our combined energy to do group healing on someone also in another location. And it might sound a bit like that's unrealistic, but when we broke into teams, in small breakaway groups, and we learned how to do energetic scans of the person that we were working with, even though we weren't in the same room. And then afterwards, we were able to discuss that. And the things that we found that were proven to be accurate by the feedback that we got was really quite mind-blowing. So I have no doubt now that group healing from a distance is possible, and that when it's led by an experienced facilitator, it makes all the difference. And so that's what the teachers in the Hands for Healing training are. They're very experienced facilitators with an incredible wealth of experience working clinically with patients and able to share that experience by describing what to feel and what to look for. So I definitely would recommend doing it. And the Zoom training does not make it difficult. And in fact, it makes it, you're able to just connect from your own home. And so you don't have to travel interstate or overseas to be able to do the training.
That is a very good opportunity to do it from your home, as COVID was bringing.
It's amazing. And I I have 3 children, and so
that was the next question. As a mom, just at home, as a normal mom, not a health practitioner, are you able to apply these techniques with your children?
Yes. Yeah, that's I'm glad you asked that again, because that's one of the main things that I love about it, is that it's so great for children. My daughter broke her ankle in a skateboarding incident, and she ended up with like a triple fracture and a cast that she had to have on all through the summer holidays. And she would ask me, she'd call it the healing thing. Can you do the healing thing? And so I say, yeah, I'll do the healing thing. And so I'll just sit with her at night and I do the hands healing techniques. And it really made her, in the early stages, it made the pain level go down. So it just made her more comfortable. So it's quite uncomfortable sleeping with a heavy cast on your leg to go to sleep, and that would just help her, and the pain would go away and the ache would go away and she would just be able to sleep. So I found that I was really impressed with that. In my just observational experience with that, it helped more than Panadol helped, and it just was able to just get that pain really, really low. The other thing is that I use it immediately if my children fall over and they hurt themselves, and I just like my son just hurt himself the other day and had his elbow, and I just immediately like cup his elbow in my hand and just feel the energy there, and do that for a little bit, and then it just helps with the healing and it helps him stay calm. And so they're used to me doing that now, and I find I like to describe to them what I'm doing so that they learn from the young age that energy is real and energy healing is a real thing, and then they ask for it because they like it. And then the other thing I do with them is when if they get a sore tummy, I work on their tummy. If they get a headache, I kind of, there's a whole lot of techniques that I can do, and it's just easy and quick. Often I do it just when they're getting into bed, or if we're lying together on the couch. It doesn't have to be a full on, like you're lying on a treatment table kind of thing, or you're following a very specific protocol. It's more like, oh, there's something that I can work on, and I'm sitting here and I'm with them. And so I just am able to do that, and they love it.
Beautiful. So it's not just for health practitioners, could be for parents that they don't need to study medical doctor. They could just do this training.
Absolutely. And the way that the training, like even with my background and the training that I have as an acupuncturist, I was the only, there was another health practitioner. There were 2 in the group that I went through with the training. 2 of us were health practitioners and the others were not. And the training was staged in such a way that the information was built upon with every session, and that there was no assumed experience necessary to start. Probably in some areas I had an advantage with the background that I've got, and so I was able to then take that to the level that I was able to use it at and start practicing straight away. But that didn't put other people at a disadvantage. And, so the training actually, it could be both for health practitioners, or it could be for mums, or it could be for people who are wanting to get a better understanding of the energy within their body. And it's very, there's a lot of breath work and alignment practice that you do as an individual before you then use yourself to apply energy healing on anyone else. And those exercises and those practices are fantastic in themselves. And so, yeah, I think definitely the training could be fantastic for mums and dads, and grandmas and grandpas, and anyone who wants to connect more with the energies of their body, have a tool that they can use to heal themselves and people in their family and their friends, if they need to, as well as health practitioners to enrich their energy perception skills, as well as the detail of information from their palpation that they might do, as well as a complete system of healing that they can apply in certain circumstances if it seems that their existing skills are not quite meeting the mark of what they want to do, which is what I feel in my practice sometimes.
Awesome. Was very, very good testimonial of the Hands for Healing online training. Many thanks, Sigrid.
Thank you, Maite. Good to talk to you again. Looking forward to the next training.
Yes, thank you.
Bye.